Good afternoon, everyone. Welcome to our webinar, Innovations in Supporting Emotional Well-Being on Campus. We are still waiting for a few attendees to join. This has been a very popular session, so we're just going to hang on for a couple more minutes, and then we'll be back with you. Thank you. Okay, I think we're going to get started. My name is Mike Mayer. I'm with Kognito, and we're hosting the webinar today. And again, the webinar is Innovations in Supporting Emotional Well-Being on Campus. I want to just introduce our presenters real quickly. We have from the JED Foundation, Dr. Nance Roy, who is the clinical director. We have Dr. Victor Schwartz, who is the medical director. From Tulane University, we have Lindsay Greason, who is the director of the Center for Wellness and Health Promotion. And we have Ron Goldman, who is the co-founder and CEO of Kognito. The agenda is broken down into three parts. The first part is to really cover the gaps. What are they, and what are some of the innovations being used to close them? Part two is on digital innovation, and you'll find out how to use digital experiences to support emotional wellness programs, and we'll get to a small demo in that presentation. And finally, we'll close out with a campus spotlight on what Tulane University is doing in terms of best practices. And we will have time for Q&A at the end. So please be thinking about your questions, and you can post them on the right-hand side. We will move quickly. I would suggest to have a pen and paper ready to capture email addresses, because our presenters will post them. But also we will be sending these slides around after the presentation. So with that, I'm going to turn it over to Nance Roy to handle part one. Nance?
Thanks, Ron and Mike. Actually, this is Vic, and I'm going to start because I'm the one who's actually wearing clothes. Sorry, I just couldn't. That's a great picture from Nancy's wedding, so that's the explanation for the somewhat unconventional appearance of her picture on this. Right. Just to kind of set the stage for the conversation a little bit, you know, the JED Foundation is involved in a number of programs that are available for colleges, for their students, and counseling centers. And one of the lead programs we're now running is something called the Campus Program, the JED Campus Program, through which we are working with schools to do ongoing surveying of their campus-wide activities, work with them to give them feedback and help them organize their programming to support the emotional well-being of students on campus. We've now, in the first year of the program, or year plus a little bit, got a bit more than 100 schools in the program, and Nancy is really the clinical lead of this program, and in that role has been in the really interesting position of gathering a tremendous amount of information out there about what campuses are experiencing. Actually, Tulane, who you'll be hearing from soon, is in the program, and really has begun to gather a great bit of information about what campuses are doing, where there are challenges and gaps, and what are some of the things that are really highlights of what campuses are trying to do to address some of the gaps and challenges that are coming up in her discussions with campuses. So at this point, it's my pleasure and honor to turn the program over to Dr. Nancy Roy.
Thanks, Vic. Occasionally I do wear clothes, even though my picture doesn't clearly represent that. Okay. So, as Vic mentioned, I have been traveling around the country to visit quite a number of schools at this point who are working on the campus program, which is, as Vic mentioned, a program to promote emotional well-being and prevent suicide and substance abuse on college campuses. And so as I've been talking with teams at each school, really certain themes have been jumping off the page and coming to a head on things that a lot of schools are working on, and not the least of which is policy. I'd have to say it's probably the single biggest issue that most campuses are working on right now, and that are finding various gaps in their policies around things like medical leaves, mandatory leaves, quite a bit of confusion around mandatory leaves, having policies regarding return from medical leave. Some schools have policies, some don't have policies. There's some that have one policy in one school, like their School of Public Health, and a different policy in their law school, for example. So there's quite a bit of work to do around policy, it seems, on campuses. And then the other place where we're finding a lot of variability is on protocols for managing substance abuse. You know, what happens when students need to be transported to the hospital for intoxication or serious substance misuse. So those are two of the policy issues that really jump out. So in terms of what some schools are beginning to do, many schools are pulling out their policies and really taking a look at what are some of the recommended practices that you want to consider in your medical, mandatory, and return from leave policies. What are the things that are going to best support students as they leave and while they're out on leave, as well as when they come back? What are some of the supports we need to have in place? What are some of the things we really need to consider in order to ensure student success? In terms of substance abuse, many schools beginning to put CBERT protocols in place to look at treating and responding to serious substance use, really taking a look at beyond just disciplinary sanctions, really looking at how can we focus more on prevention, education, and treatment, and try and separate that out from discipline-related sanctions that sometimes occur at some schools. Another big area that folks are moving toward, which is incredibly important, is developing memorandums of understanding with providers that they refer to most frequently in their communities. So we know that many schools have, if you will, regulars that they tend to refer to, whether it's outpatient psychotherapists or certain hospitals for, especially for psychiatric hospitalization. And while they have some loose understandings and relationships, nothing is really written down and clear, which really does help streamline the process when a student is in crisis and needs to get care urgently. So many schools putting MOUs in place. And then lastly, a very sort of simple thing that many schools are doing on the front end are collecting mental health and substance abuse histories on incoming students, along with other physical health forms that many schools require, so that if we do identify students who have histories as they arrive on campus, we can point to the resources that are available to them when they arrive.
And Nancy, I just wanted to add one quick thing around the leave of absence policies and some of these protocols. The JED Foundation has a document called Student Mental Health in the Law, which does provide some basic guidance in that area. That document is in the process of being updated and will really be including more content and more guidance to help schools really think about their policies and protocols in that area.
Okay, the next sort of section that we focus on in the campus program, and where we're finding a lot of gaps, I would say, is really paying attention to how few life skills students seem to be coming to campus with, and really the growing need for programs, workshops, etc., to really hone in on helping students develop basic life skills. And we're talking about things like sleep hygiene, eating well, managing their time, getting some exercise, managing money, doing their laundry, simple, basic life skills that many students are coming to campus ill-equipped to manage. And then in addition, on top of those things, needing to navigate academics, living with people different from them, living away from home for the first time, really can lead to students feeling easily overwhelmed. So developing some programs to focus on that. If you could just flip back for 1 second, I think there was one other. Yeah, okay, that's fine. Go ahead. So many schools are putting together life skills groups, and one of the good things about the psychoeducational groups is that they need not be always carried out by the counseling center. And in fact, the more widespread across campus these groups where they can happen, the better. So they're happening at recreation centers, in res life halls, academic advisors, so a whole host of folks across campus beginning to do some psychoeducational groups.
And one of the things that we really try to get campuses to think about when looking at programs like this is making sure that you're thoughtfully coordinating. So even though the counseling center may not necessarily be the office through which the program is run, there's real benefit in, through the counseling center and student affairs, having a coordinated, integrated approach so that you really try to get the greatest spread across different areas of campus, whether it's res life or clubs or groups of the greatest array of different kinds of programming, so that people aren't stepping over each other's toes and doing multiple redundant programs in one very narrow space, and then kind of leaving other areas of campus unresponded to or underserved with programming.
Okay, when we're looking at student wellness, we're finding oftentimes when we go to websites, for example, health and counseling websites, not finding, emergency information prominently displayed, like who to call, where to go, especially after hours or in the case of an emergency. A lot of variety around services and programming for substance abuse and mental health. And oftentimes, and this is a big emphasis, is wide variation in the amount of coordination between health and counseling services, from schools that are fully integrated to schools where they're far separated, not only geographically on campus, but also in terms of collaboration. So we've worked with quite a few schools who are really focusing quite intently on that collaboration between health and counseling, oftentimes doing things like at least having joint weekly meetings to discuss shared cases. Some are fully integrating an electronic medical record. Others are doing so, with some firewalls, but really thinking with each school about how can they increase their communication and collaboration to provide a more holistic response to student well-being. Cross-referencing, by the same token, around integration, cross-referencing materials on health and counseling websites. That's happening quite a bit, so that folks are students are accessing information sort of almost no matter where they go on the health or counseling websites. In terms of substance abuse, really security, facilities, operations, other deans, other folks on campus really working with area bar owners to address the issues of substance misuse when students go off campus. Many are expanding their educational campaigns to use social media more effectively with their students in promoting mental health. So those are a few things around the student wellness piece that folks are doing. In terms of looking at at-risk students, one of the most important things we try to emphasize when we're working with schools is that really these issues need to be seen as a campus-wide responsibility, and not really the sole responsibility or primary responsibility of just the health and counseling service. So really taking a look at the wide variation among campuses on who is trained to identify students at risk. We're finding oftentimes there are very, very few folks that are trained in terms of how to identify when a student is struggling, what to say if you do come in contact with a student or identify someone who's struggling, and knowing where to refer them. In that regard, communicating among offices and having systems in place where folks who are identifying students are in who are struggling have an opportunity, whether it's an electronic system or some system in place for reporting and communicating their concerns with the appropriate offices on campus. We're also finding a lot of health services not screening for mental health or substance abuse when students come for regular health visits, and we're finding that it can be incredibly helpful to have health services screen for emotional well-being when students present for medical concerns, since we know so many students do not use the counseling service, and many do use the health service. There's a lot of variability in how well schools are catching those students who may otherwise fall through the cracks.
And since I seem to be playing the role of being the reference guide here, it may be helpful for people to know that the Higher Education Mental Health Alliance, or HEMA, has developed a guide for campus at-risk teams, which really has some very useful information. Nancy's going to mention that in a moment. And this is a very important function on campuses for connecting and communicating around students of concern. And obviously, Kognito is an important tool in helping train people on campus to be able to identify and know how to communicate with people who may be in trouble. And you'll be hearing more about that later on in the discussion.
Great, and so what some schools have done, folks are attacking this from many different angles. Some are developing case management systems in their health centers for working with students who are identified at the health center who may be at risk, and really trying to provide support and holding them within the health center system. Many are expanding and developing their gatekeeper training protocols across campus. Some schools are making those mandatory. Almost all schools are establishing BIT teams if they haven't done so already. I already mentioned developing systems like Maxi and others that are electronic, that faculty, students, and staff can enter in their concerns, and typically those concerns will go to a BIT or a care team. Many are establishing partnerships with their athletic department and their rec department to identify, especially for athletes, athletes who may be at risk, training coaches especially to identify students who may be struggling and know how to reach out. Many health services are beginning screening for mental health and substance abuse. And in terms of mental health screenings, which I would say almost all schools tend to do, many are now just moving toward having multiple offices on campus offer those screenings well beyond just the Health and Counseling Center. In terms of mental health, we're finding at many schools a fairly long wait times for an appointment at the counseling service, with triage systems that are often inadequate in meeting the acute needs when someone is in crisis, or are having protocols for dealing with students who present emergently, but no staff available to see them on the spot. Another issue that we're finding folks struggling with is not having a protocol in place for dealing with a student death or suicide. And for those that do, not always having the people who are to be involved in response actually aware of what their role is when they're, even if there is a protocol in place, not necessarily understanding what their role is. So we are looking at that issue with schools as well. And lastly, the response to opiate use and misuse on campus. Almost all schools respond that that's not their biggest substance use issue on their campus, which we understand, but it is in fact the fastest growing substance that's being misused on campuses, and of course we know, oftentimes fatal. So really working with schools to look at that. So in terms of what folks are doing, many are adding quite a bit to their websites, things like mental health screening tools, which many students have been accessing, reducing their wait time for appointments by really also looking at triage systems. So implementing things like walk-in hours. Some are extending hours or offering hours past your typical 5 o'clock cutoff time. Many are putting together a postvention guide, and I won't have to rely on Vic for this one. HEMA has also just published a postvention guide for folks to take a look at, which really is a fairly comprehensive document for you, if you do in fact have a postvention guide in place, to really take a look at as a checkoff and see if all of the things that we suggest or that document suggests you consider are in place in programs. So many schools are finding that very helpful as they put together a guide or edit the guide that they currently have. Many are doing targeted messaging around substance abuse and mental health around high stress times, whether it be exams and targeting stimulant misuse or big social events on campus, whether it's a big athletic game or a dance or what have you, and taking those opportunities to really hone in on being safe around certain events. Doing a lot more on the dangers of stimulant and opioid abuse, and also in prescribing stimulants and opiates on campus. Putting policies in place to minimize the number of pills that are prescribed, things like that, and getting access to naloxone on campus if permitted in their community by first responders, so that if they do have a student who's having an opioid overdose, naloxone, as we know, can save lives. And lastly, means restriction, which we know is the single most effective strategy for reducing suicide on college campuses. And in spite of that, most schools that we've visited have not ever completed an environmental scan. Really going through campus to take a look at what are potentially dangerous areas on your campus, things like bridges, atriums, rooftops, windows, things of that nature. And so many schools are beginning to conduct environmental scans, getting their security folks and operations and facilities on board, and doing that annually. I mean, we know that there's also, at many schools, almost continuous construction going on. So even if you feel like you've done one recently, as things change and new buildings are either renovated or being built, it's important to continue to keep that on the radar. Some schools are installing the breakaway closet rods, which are really a fairly simple and inexpensive thing to do. Implementing pill collection days on their campus, or coordinating those with area people in the community, either hospitals or oftentimes police stations do that. Really taking a look, as we mentioned, at potentially dangerous areas and putting safety strategies around, windows opening only a certain amount, labs, toxic substances being controlled, things of that nature, and whenever possible, restricting firearms on campus, and in those few cases where firearms are not prohibited, really thinking about their safety protocols. So in a nutshell, those are a few of the things that we've been able to come across so far and develop as themes, and some of the innovative ways that schools are attempting to address them.
Great. Thank you very much, Nancy and Victor. This is Ron Goldman, co-founder and CEO of Kognito. I'll cover the second part before we get to Tulane. And what I wanted to do today is, first of all, give you just a very quick overview about us, but really tell you about how we have been really supporting campus mental health through the use of simulations to help in training faculty, students, and staff around mental health. So just quickly about us, for those of you not familiar with us, we're a small business based in New York City, which is really a simulation and a learning design company. We concentrate on building online experiences that really help people prepare for the conversations that matter the most. And for us, these conversations relates to social, emotional, and physical health. We're a group of about 50 people, everything from learning design scientists to psychologists and mental health individuals and software engineers. And really what we do, and you will see a lot of the campuses around the country, is build in partnership in many cases with nonprofits or experts in the field, these online and mobile experiences which schools end up integrating as part of their comprehensive approach. We've been able to work with a lot of different organizations around the country, and you can see really the last bullet here, and if we have time I'll get into this. My colleague and co-founder is Dr. Glenn Albright, who is a clinical psychologist, and he runs our research team, looking really at the efficacy of these simulations in terms of not just building knowledge and skills, but actually driving changes in behavior. We've been able to have 3 of our simulations, including the one I'll demo for you today, listed in SAMHSA's National Registry of Evidence-Based Programs and Practices, which is obviously a great honor for us as a small business. So what you will see today and in the demonstration is really what we hope is contributing and a valuable solution for schools. And it really concentrates around helping people have these conversations. And in the case of mental health, clearly if we're looking to have faculty and students and staff not just recognize a student who is showing signs of psychological distress, but actually go and approach them and have that conversation. That is clearly a challenging conversation. Most of us have never been trained on how to do it, and the best way of learning it is through practice. And that's what we do with these simulated conversations. As you will see in the demo, where you actually can practice what's the right or a better approach to engage that individual in the conversation, talk about your concern, and build that motivation in them to seek help. So this really started for us as a company. We've been around for about 10 years, and about 5 years ago, we looked very deeply into this area of mental health and talked to a lot of different schools around the country. And what we found is that, a lot of them, as Nancy and Victor mentioned, they do gatekeeper training. It's kind of the traditional term for it. A lot of it is in-person workshops. Sometimes they do some communication campaigns. But they have a lot of challenges that they communicated to us. And again, the first part kind of highlighted a few of them. The first one was administrative. It is very difficult to get people to come to an in-person. In many cases, counseling centers are already understaffed. So for them to organize events and get people to come in is tough. Scalability, especially when you're in a large school, in-person workshops is difficult. This is where the internet and mobile devices are clearly very, very helpful. The third challenge that they communicated for us was around, how do we know who's coming? How do we know how good it is? How do we track that usage and evaluate the effectiveness? The other thing was, how do we standardize the quality? So different trainers have different level of how competent they are. So how do we keep it standardized? The fifth, which is clearly a challenge, is if it's not mandatory, how do I get faculty, staff, and students to actually want to come or engage in any type of a program around mental health? The sixth one for them, which I think really speaks to number 7 as well, which is the learning modality, is they were a little bit discouraged by some research that was done that showed that after people engaged in a training, their pre to post change were very dramatic. There were statistically significant increases in any measurement whatsoever. But then when those studies looked at 1 or 2 or 3 month follow-up points, those increases literally disappeared. So the schools we spoke with said, how can we find a way of really sustaining it? And the 7th issue was around the learning design. What we heard for them is, we are expecting these individuals to not just build knowledge about mental health or address misconceptions they have or lack of knowledge. We really want to activate them. We want them to go out there and not just recognize or identify a person at risk, but actually know what to do. How do you talk to your friend that you're concerned about? How do you talk to your student that you're concerned about? And that requires practice. I mean, nobody here learned how to ride the bike by watching a movie of somebody else doing it. We all sat on the driver's seat or on the bike seat and tried it. And we failed and we learned, and that's how we got better. So what they communicated to us is that we feel like we're asking people to do something, but we're actually not giving them the right type of practice to build that skill and build that confidence. So what we did is, using our learning design expertise and our simulation environment, is we built a whole suite of programs, which, looking at the over 200 people on this webinar, many of you are familiar with, which are really aimed as a training or as a professional development, as an online experience for faculty, for students, for RAs, for staff. Fairly brief, 30 to 45 minutes. And they clearly go over the basics of what you need to know about warning signs and general mental health. That it's also not just about suicide prevention. There are other elements to be aware of, from depression to anxiety, substance use, etc. Understanding what are the available support services. But the unique element here, as you will see in the demo, is really allowing you to have that conversation, to practice it, and to see what are the proper and the best practices to really do that. As you can see, it's been a very successful suite of programs for us. There are over 400 schools in the United States and outside that have been using it, and a fairly extensive amount of research that showed the efficacy of this program. So let me quickly just show you how this works. And the one I'll highlight is the student one. This is a peer-to-peer simulation, where it's a 30-minute designed for students as well as RAs, where you literally learn the basics about mental health, and you get the option to really engage in a realistic conversation with a virtual student who has been showing signs of psychological distress. And you have that very specific goal to go and meet with them to talk about your concern. And then, if your concern is true, because you actually don't know what's going on with the kid until you actually talk to them, if you see the need for it, to start talking to them about seeking help, which is clearly not an easy conversation to have. And when we did focus groups with students and work with the expert, in many cases students will bring up, I'm concerned about you very early on, and will kind of shut away the kid from actually participating in it. So I'm going to open this up because I want you to actually be able to see how these conversations are conducted. So what you're looking at is literally the simulation itself. There's a number of components, as you can see, this menu here. Everything about an introduction, talk about mental health, the signs to look for, but really the main event here is the talk, right? Let's get some practice. So let me play a little bit of this, and then I'll show you how you interact with this virtual student.
Jesse wants to talk to Travis to see what's going on. Conversations like this should always happen in a private place. So Jesse has come over to Travis's apartment to talk. The most challenging part of talking to a friend about a sensitive topic is bringing it up without making the friend defensive. Jesse has some ideas for things he might say to Travis. Go through each one and decide if you think it's effective and will help the conversation, or ineffective and will make Travis defensive. You need to get at least 8 right to continue. If you're stuck on one, just ask yourself how you'd feel if a friend said this to you.
So the first thing that we do is we give you an actual ability to go through some exercises to look at whether an option is an effective or ineffective. A lot of this is coming from motivational interviewing skills and technique, which is really the underlying theme of what we're teaching you here. And as you go through the conversation, you can make specific decisions of what you will say as a student, and actually see the responses of Jesse, who's the virtual student who's here in the back. Due to a little bit of time constraint here, and because I want to make sure Tulane has sufficient amount of time to go over stuff, I'm going to rush a little bit through this. But the idea here, again, is to allow you to actually practice that conversation, make specific decisions, and see what works and what doesn't work. Now, what we found when we did when the research was conducted to look at the efficacy was very, very interesting, because clearly we wanted to see whether we can build skills in the individual, and by skills are the things that you're looking at right here, from being able to identify when a behavior of a peer is a sign of psychological distress, or to discuss your concern, clearly motivate a peer to seek help, and make a referral. And what we found, that you can see a little bit of the demographics here on the top. I mean, this is almost 300 students at 20 different institutions. What we found is that there were, just like with a lot of other programs, as expected, the pre to the post went up in a statistically significant level. But what we're happy to find is that in a follow-up, which was done 3 months after, it went down, but it was still statistically significant when you compare it to the baseline, to the pre-training. So what this indicates or suggests is that the simulation aspect of this, the fact that we can give you the practice, not just kind of lecture to you or tell you, don't forget to be sensitive and don't jump into suggesting that he is depressed. The fact that we allowed you to practice this and get personalized feedback potentially helped in sustaining the impact of this program over time. And I can tell you in other programs that we have done for faculty that even when we went 6 and 12 months after, we still saw a significant difference when compared to the baseline. But what we really wanted to look at, and in this case you can look at satisfaction, clearly very high rating by students in terms of the program, on how realistic it is, on whether they will refer it to a friend. But what we wanted to look at is changes in behavior, right? So if we're all aiming at getting more students in this case to reach out and approach and refer more students, this program actually did that, right? Because that's our goal. We're looking at behavior change. What you can see here at the bottom is that one of the questions that we ask participants is before the training, and then again 3 months after, is to give us the number of students that in the past 2 academic months they actually were concerned about, approached, and referred. So clearly what you're seeing here is an average of all those that participated in responding to this. And what you can see, which I think is really interesting, is this percentage increase. So this indicates for us that there was an increase of 27% in the number of students that those who took the simulation said that they were concerned about 3 months after. There was a 70% increase in those that they approached. And there was a 53% increase in the number of students that they referred. So this indicates for us, although it is self-reported, so there's clearly some limitations here, but this indicates to us that the students who went through the program actually translated their experience into real-life action. And I think what's also interesting here to mention is from a self-referral is that they also indicated that in the 3-month follow-up, that there is an increased likelihood that they will self-refer. So this is interesting, right? Instead of us talking directly to the student and say, you may have an issue, and if you do come to us, here is a friend that you might be concerned about, and this is how you can help them, and indirectly it gets them more motivated. And we had similar results with the faculty, but I want to conclude with that because I do want to make sure that Tulane has enough of time here to cover very, very interesting innovations that they have done on campus. So with that, Lindsay, I want to hand it over to you to go over your part of the webinar.
Thank you, Ron. My name is Lindsay Greason, and I am a health educator by training, and I serve as the director for the Center for Wellness and Health Promotion at Tulane University, which is known on campus as the Well. And just to kind of start with giving you an overview of Tulane, I wanted to kind of cover some demographics if you want to go to the next slide. We are in New Orleans, Louisiana. Our enrollment is about 13,500. We do have undergraduate and graduate and professional students, including medical schools and law schools in our graduate and professional student population. Undergraduates about 8,000, 8,300, and then graduate and professional students about 5,100. And you can see here that we do have more females than males on our campus. And we are a Division I NCAA school in the American Athletic Conference. So that just gives you some context for the work that we're doing within New Orleans and our kind of community at Tulane. We are fortunate in that part of our innovative practices is that we do try to partner with national organizations for guidance and support. So we are a part of the Jed Foundation campus program. We are also the recipient of a SAMHSA Garrett Lee Smith Suicide Prevention Grant. We're entering into our 3rd year. And so that really allows us to have the support and guidance that we need at Tulane to try some new things, because we've been able to put some good foundational things in place. Also, just for context, the Center for Wellness and Health Promotion reports up to a unit within the Division of Student Affairs. Within Campus Health, there are 3 units. One is the WELL, the Health Promotion Office, in which I oversee. Also, the Counseling Center is within our unit, and the Student Health Center. And there's a governing board within Campus Health that I'm a part of that allows us to make kind of an interdisciplinary approach in our decision-making for setting up the Counseling and Student Health Center, which allows us to really kind of be holistic in the way we're approaching things. So that's just a little bit of context for Tulane and the situation I'm working under. Today I want to cover 3 main things when it comes to innovation to support emotional well-being. Keeping in mind the lens that we've brought is 2 main things. One, sustainability, because we have this 3-year suicide prevention grant. We wanted to build things out in a way that were going to allow us to sustain them even after those funds ran out. And also with the eye for collaboration, recognizing that that would support sustainability as well as help institutionalize the importance of emotional well-being. So with a lot of this, I'll try to key you into some of the key collaborations that we have made and how we did them so you can integrate them into the work that you're doing on your campus. So the 3 main things I'm going to cover is our Mindful Collaborative, some of our marketing and communication strategies, and then our gatekeeper training here at Tulane. So to dive in, I wanted to briefly mention this idea of mindfulness, which may or may not be new to some of the listeners on the webinar today. Basically, it's a practice of purposely bringing moment-to-moment awareness to our experience without judgment, and it involves a very compassionate, present moment disposition. And so we talk with our students in our campus about, it has 3 main factors that support mindful living and mindfulness skills: intention, attention, and attitude. So mindful practitioners, they have the intent to be present, and so sometimes we know with students they can ruminate about the past or really worry about the future. And mindfulness sets the intent to be present in the moment, in the now. The attention is to whatever is happening or whatever they are doing. So if that is studying, if that's having a conversation with a friend, or if that's being in class, having the attention to what is actually happening. And then the attitude is really important, and that is one of curiosity and non-judgment. If we are bringing all this attention to the present moment, if we don't bring kindness to ourselves, then it can create even more anxiety for folks. And so that's really important in the way we talk about mindfulness. There's a ton of research to support the benefits of mindfulness, like creative thinking and communication, emotional regulation, but within the Mindful Collaborative and the way we talk about mindfulness, we wanted to be very consistent and clear about the benefits and how they most apply to student well-being on campus. So we talk about them in these 3 bullet points on all of our marketing, all of our videos, to try to make it as concrete as possible for folks. So it enhances the sense of well-being and quality of sleep, increases focus, attention, and concentration, and then also increases ability to manage anxiety and stress. Not to get rid of anxiety and stress, but to help manage it as that coping skill. And so, I was at an institution prior to Tulane where we had a mindful offering, and it was really wonderful. And taking that experience and coming to Tulane, I wanted to expand it to be a collaborative model, recognizing that if we wanted to create a more mindful Tulane, we had to get as many stakeholders involved. Also, the well has, 7 staff members, where other departments have even a larger staff. And so we wanted to leverage the entire university to offer these different trainings to students on campus. So we started with recruiting members for the collaborative that we worked a lot with. And so we coordinated very closely with our counseling center. The director and I met pretty often about, formalizing this, setting up trainings for it, and recruiting members. We have faculty as a part of our collaborative. We have folks from the Center for Innovative and Design Thinking, which is an academic department, and we have folks from the Office of Disability Services as well as our Health Promotion Office, the WELL. That's what we started with. Moving forward, we're working with Office of Multicultural Affairs, the LGBTQIA office, our Conduct Office, and our Case Management Office to get them trained to be a part of the collaborative. What we did to set this up is we met with Dr. Codron Albo, who is a psychiatrist in the New Orleans community, and also Dr. Mary Stark, who's a PhD and licensed clinical social worker. They came and offered a training to about 12 staff members, 8 hours long, to be able to lead mindfulness sessions for students. And then we meet as a collaborative once a month to get supervision. So they come to campus, 3 different people practice what we are doing in the drop-ins or in the course, and they provide feedback, which is really useful. From a sustainability perspective, they are now training myself and some other members of the collaborative to offer that training so we can sustain it after the grants. And so in terms of what we offer, and this can be something for you to think about at your university, we started with offering drop-in sessions at different times throughout the week where basically 2 facilitators of the Mindful Collaborative would come and lead 2 activities, 15 minutes each, and students could come and check it out. And we really tried to frame it around roll with the wave, we're the green wave, and so we wanted to incorporate that. And we talked to students about showing up, tune in, and chill out. That's kind of our tagline, and you're welcome to steal it. Then we've continued to develop as a collaborative, and we offer a 4-week course, which we have modeled after KORU at Duke University. It's an hour and 15 minutes where you can do it once over a 4-week period or twice a week in 2 weeks. And so the maximum amount of students we have that we take for that is 15, and we have offered that 3 times a semester, and it always fills up and we have a wait list. So it's something that students are really latching on to, and we have many different facilitators who can do that so we can have so many offerings. We also partnered with faculty in the law school for them to do a mindful lawyering course, which has also been very popular. And we also recognize that working with law students, they really wanted to have people from their university or their school teaching that. So we did work with faculty to train them and work with them so they could do a mindful lawyering class. And then recognizing that we really want to try to have an environmental approach and institutionalize mindfulness. We do a lot with the Division of Student Affairs, athletics, and academic departments about bringing mindfulness to the workplace. So we have a workshop that will go in and talk with faculty and staff about that so they have an understanding of what mindfulness is. We also did a TED Talk on mindfulness that allowed faculty and staff to have an understanding of what it was and engage with the collaborative. We work with parents and families to offer mindfulness workshops during family weekend as well as webinars on the topic, recognizing that they have a lot of connections with their students and can reach out. And then we also recognize that some students are commuter students or upperclassmen who don't want to participate in this and come back to campus for whatever reason. So we have an e-health promotion tab that's very strong on our website, wavehealth.tulane.edu, where there's audio recordings of mindfulness. We have a list of apps. We've developed a mindfulness workbook students are encouraged to use. And then we also have worked with our peer health educators to develop videos to promote the idea of mindfulness, which you can look at our YouTube page to check those out. So that is the Mindful Collaborative. I encourage you to think about, can you set that up on your campus? Many different people can be facilitators, and it's something that you don't necessarily have to have a clinical background to try or do. So it's really exciting to bring to a university, and students do tend to reach on to it. The next thing I want to talk about is some marketing and communication. We do a lot of different things to try to get out information about life skills, emergency resources, normalize help-seeking behavior, and really have them understand all the different resources they have on campus. We do a monthly Stall Street Journal in the resident halls, as well as the exam rooms at the Student Health Center, and the restrooms at Student Health Center, and the CAPS office to try to get out that information. We work very closely with graduate and professional students through our Health Wave, which is an online forum that we use MailChimp to send a monthly newsletter with all the different events, as well as those life skills promotion, as well as the resources. And that is very popular with them, and they oftentimes tell us that they've read it and come to our events as a response to that. And that's pretty low time intensive, where MailChimp is a good way to reach out to those students. We work with the registrar's office to get their email addresses each semester. One other thing in terms of marketing communication that's been big for us this year, we use GoToMeeting. We have an account, and we do a lot of webinars with many different folks. So we try to do webinars, or we have done webinars with faculty and staff to let them know about how they can support mental well-being on campus, promoting gatekeeper training, as well as some signs of psychological distress, and letting them know about the resources on our campus. We do that with parents as well, and it can be sometimes educational about how to foster resilience, and other times the intent is to promote resources. So that's been a really great addition to our communication strategy this year. We post them on our YouTube and then on our website afterwards, where people can continue to listen to them. And then we utilize social media to reemphasize all of our points. We have Instagram, Twitter, Facebook, and YouTube. And so I do invite you to check out our YouTube page, because we do have a variety of videos on there. And then this year I wanted to highlight for you some of our campaigns that we have been focusing over the past 2 years as a way to get out information related to emotional well-being. So the first one I'll show you, and again, these are up on our website, and we're happy for you guys to use them. The first one is Yellow is the New Black, and the goal of this was to increase students' willingness to help their peers during crisis, and to increase help seeking among suicidal individuals and others in crisis. The campaign was modeled after Orange is the New Black, which was very popular at the time. We did t-shirts, tank tops, a variety of material, including notebooks. A lot of our faculty are outlawing laptops in the classroom, and so they have to use notebooks. So on the inside of the notebook, you can put a lot of information, which they're just sitting in class reading. And so we put a lot of resources as well as signs, and that was a very popular campaign on our campus. And again, just trying to raise that awareness in the first year of our grant. The next one I want to highlight is one we're doing right now. It's called Thrive at Tulane. We're really trying to promote resiliency and self-care to support emotional well-being on our campus. And so you can see that we created this logo where Thrive at Tulane, including, or kind of has these different components of reflecting, engaging, caring, and connecting. And so each month we're releasing a different poster as well as educational content to support that theme. You can see at the bottom that we also are trying to promote resources for students who would like to reach out and talk to someone. So we promote at the bottom crisis text helpline, which is a texting crisis line. We have something at Tulane called The Line, which we have promoted starting August 2015, which is a 24/7 crisis line that students can call if they are, if they're upset about their partner breaking up with them, or if they had a bad test, or if they're feeling suicidal. So it's really the gamut. So we're trying to get the word out about that and promoting that for students who may not feel comfortable going to CAPS or need some case management on what to do. And then we also promoted the 24/7 Trevor Line hotline on our posters. And you can see the different themes there about sleeping, mindfulness, reflecting with someone you know, and connecting with campus resources. So that kind of wraps up some of our marketing and communication strategies. I want to end quickly talking about gatekeeper training, which has been really successful here at Tulane University. We have mandated online gatekeeper training for all freshmen and transfer students. We did the Healthy Mind study where we were able to demonstrate that students talked with each other more than anyone else if they're experiencing psychological distress, and work with leadership on our campus to mandate that for students coming to Tulane, as well as an alcohol program. And so that data piece from Healthy Minds was really instrumental for us. We also offer Assist and Safe Talk, which are two Living Works programs that we offer to all faculty and staff. But I'll say that we were very intentional about collaborating with athletics and our Tulane University Police Department. We really targeted athletic trainers, so wanting to cue you into those folks because they have very close relationships with athletes. And so coaches are great if you can get them there, but athletic trainers also can be really great to partner with to go through gatekeeper training, as well as the police departments. And we were able to make it so that it was a part of their annual training to be in gatekeeper training, because they are the ones who respond if there is psychological distress and there is 911 called on our campus. And so it was really great to have them as a part of it. And then we also focused a lot on student affairs. We had everyone through the Student Health Center and Counseling Center go through Safe Talk. And so we've been very successful in using those two programs. And then we also have an online training for faculty and staff. We do use Kognito, and we have used it that in working with deans for them to send it out to their faculty. We put it in newsletters. We're always trying to promote that. It's only 45 minutes long, so if a faculty member can't come to Assist or Safe Talk, they are encouraged to attend that and go through that training online. We also have RAs go through the online training as well as the in-person, and really have used our Healthy Minds data to build capacity for that. So that kind of wraps up some of the innovations at Tulane, and we'd be happy to take any questions that you guys have for us.
This is Mike again. I want to just thank everybody for attending. This has been a great session. It's been information-packed, so we are right up on our hour. And instead of, in fairness to everybody and everybody who asked a question, what we'll do is we'll get back to you individually. Everybody who has asked a question, we will make sure that they get an answer through email. We will also be sending a round of these slides out to you. Also, just one final piece of information is that there's also another webinar on Thursday at 2. So if you found this one helpful and you think a colleague might benefit from it, please share the link with them, and there's still time to register. With that, I want to thank you again, the attendees, but most importantly, I want to thank our 4 presenters for taking the time out and really helping us understand this important and issue that's growing in importance today. So thank you, and watch your email for more info.